One of the frequent questions that any surgeon gets after surgery has to do with nausea and vomiting. This is a normal phenomenon that occurs in some people and not everybody, and once in a while it can be severe in some patients. This is usually related to the anesthesia, the surgery, and the medications that you're taking. It's not unnatural or uncommon for people to feel nauseous after surgery. If you're feeling nauseous, this is not a good time to eat and drink and take your medicines. You want to see if this will subside by itself. We give you nausea medicine during your anesthesia and during your recovery, so that will usually kick in by itself. So if you're feeling nauseous, the best thing to do is lie down, keep your head elevated, and don't move. Turn the lights off, put a cold washcloth or gauze over your forehead, and just try and relax, and frequently it will pass. You don't want to do any abrupt movements, standing up real fast, bending over, in this sort of thing. And again, if you're feeling severely nauseous or vomiting, don't eat or drink and don't take your medicines. Now, one thing that does help post-operative nausea is just taking little sips of some type of beverage like Coke or Pepsi, and you can shake it up and get the fizz out of that, or sipping Gatorade. Some people feel that eating saltine crackers helps as well. Once your nausea gets better, then you can start eating more and taking your medicines. If you have severe nausea or you're throwing up, then we'll probably need to give you an anti-nausea medicine. If you have a history of having this type of nausea or vomiting, then we should really give you this preoperatively, because you'll probably need it. But if you have uncontrollable nausea or vomiting, you need to call our office, call me, the doctor on call, or my nurse Jenny, and we will give you nausea medicine that you either dissolve under your tongue, or sometimes there is a suppository form. So again, this is not an uncommon thing after surgery, and most people have experienced this before. Usually it gets better. If you're severely nauseated or vomiting, don't eat or drink, stop taking all your medicines, do the other measures that we talked about to make you feel better, and then slowly start sipping and kind of working your way back. You won't hurt yourself if you stop all your medicines overnight if you had to. The other thing is sometimes it could be the antibiotic causing the nausea, it could be the pain medicine, so we kind of have to figure out which medicine is contributing. We are really interested in your comfort, in your safety, in your recovery.